even though the flu runs rampant this time of year, there are those of us who are convinced that we are invincible to the flu bug. Still, the truth is there's a high likelihood you could get hit with flu-like symptoms this season no matter what you do. Our next guest, Dr. Ken Redcross, is a board-certified internal medicine physician who says that in the same way someone might prepare for hurricane season, we should also prepare for flu season. According to the good doc, if you wait even 2 days after experiencing the first signs of flu-like symptoms to see a doctor, you can dramatically delay recovery time for an extra 2 or 3 weeks. Dr. Redcross joins us this morning to share the 7 common flu symptoms and how to get flu ready with his ultimate flu survival pack. Welcome, doctor. Thanks for coming in.
Thank you for having me, Byron.
First of all, why do you think most people are so resistant to get a flu shot? Because many people are in advance of the flu season. I get my flu shot, but I know a lot of people don't.
You are so right on that, Byron. I wish I could figure that out. I'd be a very wealthy man. But I can tell you this, I talk to patients a lot about that, and it's kind of all over the place. You know, a lot of people feel that they will not get it. I always talk to patients almost as if it's an insurance, like you get insurance for your car. You need to get insurance for your health and insurance against the flu season as well.
Okay. Now, how many people do you think will be affected by flu this season, I guess, and who's the most at risk?
You know, unfortunately, about 200,000 Americans will be afflicted with the flu due to the complications of the flu. 25%, unfortunately, will lose their life as well. So it's a very serious issue when you talk about the flu shot. I think the other important thing is we always use flu kind of interchangeably. When we're not feeling well, we'll talk about a little flu bug in our stomach, and so we don't take it seriously because of that. We really have to watch the elderly as well, as far as those who are most afflicted by the flu, 65 and older. Most of the deaths, 80 to 90%, are in that group.
So you talk about loss of life. I mean, people think about getting the flu. It's more than just getting a little cold.
Yeah. I think people don't understand that it's the complications of the flu that are also a problem. One of the biggest complications, pneumonia. You know, it's something everyone says it can't happen to me, but influenza, which is the flu, which is different than some of the other things we get, is something to be really careful about.
Okay, let's talk about the top 7 flu-like symptoms that we should be on the lookout for.
Absolutely. You know, we always sometimes come in and say we feel a little feverish, but when the fever gets to about 100 degrees or so, we need to really, really be wary of something coming on. A cough or sore throat. Sometimes you can even have a runny nose or a stuffy nose, which can also be consistent with that. Headaches, and it's really those body aches that I really listen out for. That's really what starts to cue me in that we're really dealing with something a little more. And then we also have chills, fatigue, and we see nausea and vomiting. And vomiting we tend to see more in children.
Wow. You know, a lot of those symptoms, you know, I think people might have 1 or 2 of them, you know, and think nothing of it.
Yeah, absolutely. That's why it's very important to talk to your doctor immediately when you're feeling these symptoms, because that's our job, to kind of sift through what's going on and figure that out. And like I said, for me, when I hear those body aches, those bone-breaking body aches, that clues me into we're dealing with a little bit more than a regular cold.
Okay. Now, talk to me about your ultimate flu survival pack that we should have on hand this time of year.
Yeah, this is extremely important because, like you mentioned, whenever I think of the flu season, I always liken it to hurricane season because we all know what to do. We prepare and we stockpile. And so these are 4 things that you have to stockpile. My practice is very holistic, and all of these are just that. They're natural. So as we go into the first one here, we have a probiotic. Now, we all have heard of probiotics, and we know they're good for us, but what we may not understand is that we lose a lot of the good bacteria in our gut when we get sick. The probiotic allows us to replenish that and really get us back to healing and boost our immune system. You know, with us being in the Boston area, it's perfect because there was a study done on college kids that showed 34% of kids actually got better when they started this, once again, early, 24 to 48 hours into the disease or into the illness.
Okay. Something you can get at over the counter?
Oh, yeah, it's over the counter at a lot of the drugstores, grocery stores as well. So luckily, it's easy to find. Much like the second thing here, this is Oscillo, which is probably the best kept secret. It's a homeopathic remedy. They've been using it in Europe for years. I love it because it uses the body's own inherent immune system to heal itself. Once again, back to the natural. There's some good studies on Oscillo as well. It's been shown to decrease the severity and the duration of illness when taken within the first 24 to 48 hours. And also good for kids 2 years and older, which is important. There were some years back when we didn't know what to give our kids. There were some studies that came out that said some of the things we're giving our kids probably aren't good. Oscillo has a place for that.
Over the counter?
Once again, over the counter and easy to find.
Okay, and moving on?
Moving on, we're moving here to prove that Mom is always right, Byron. We should have known that, but now we know. Mom is 100% right.
I know where to get this.
You know where to get chicken noodle soup. We all better know. It's funny. I don't know if Mom understood that it's pretty much a medicine. You know, there's some studies that show that chicken noodle soup actually decreases the migration of white blood cells to those areas that wreak havoc, such as to our lungs when we get the cough, or our nasal passages when we're getting the sneezing. So chicken noodle soup is a very important part of this survival kit.
Wow, okay, and finally we have...
And last but not least, we have zinc. Zinc comes in a lot of different formulations, but zinc itself is a very important mineral just for the immune system in general. So it's very important that when you feel like you're coming down with something, start zinc lozenges. Also some wonderful studies that shows when taken early, you do get a benefit.
What about the top misconceptions people have about flu shots?
You know, this is, once again, all over the place because a lot of people think the flu shot can actually make them sick. I'm here to tell you it's impossible. The flu shot actually has an inactivated virus. It's already killed and already dead. The other thing is people think, well, farmers making big bucks off of the flu vaccine, and I get it. I get the skepticism. But I'll tell you this, they make probably less than 0.5% on the flu vaccine. So in this case, they're doing wonderful things for us. A lot of people think, too, that if they've already had the flu, that they can't get it again or they don't need the shot. And I'm here to tell you that's not true either because there's different strains of the flu. And you may have had a shot for the one that came, but maybe not the one that's on the way. The other thing is they think flu shot is all they need for prevention, and once again, we don't always get it right, even though I'll say this year we're doing a pretty good job.
Okay, and very quickly here at the end, I guess I understand you have you founded a personalized medical practice, one of the first full-service concierge personalized medical practice in the United States. Talk to me about, you know, how that works, and I understand you have some celebrity patients and things.
I do. I have patients of all types and backgrounds, I'll tell you, but, you know, personalized medicine is something that just plays to me. Look, I'm an only child. I'll talk till the cows come home, okay? And I can do that when I have time to spend with patients, and that's what it allows me to do.
And you basically, these patients put you on retainer and you pay?
They put me on retainer and have 24/7 access to me.
All right, great. And finally, very quickly to wrap things up here, where can people get more information about all of this?
By all means, my website is drredcross.com, just like the American Red Cross, and at Dr. Red Cross for Twitter.
Okay, Dr. Ken Redcross, thanks for coming in, and thanks for all the good tips, and keep our fingers crossed. Hopefully, you and I won't get the flu or anyone else that takes your advice.
I like that.
Okay.
Thank you.
All right, well, that's it for this edition of Urban Update. I'm Byron Barnett for the entire team here. I'm Byron Barnett. Have a great Sunday.